Naturopathic medicine is a primary healthcare system founded on the honored universal principle that nature is the ultimate healer. Its roots go back beyond the time of Hippocrates, the father of modern medicine. Naturopathic medicine's core belief is that our body has the innate ability to maintain and restore optimum health no matter what the current status may be. Therefore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Well, that's enough about me and naturopathic medicine. Let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine so that you can get a better understanding of how safe and effective this form of medicine is. Today's topic is about the most intriguing program that I've ever done on Island Wellness. Our topic is about the treatments that are available to individuals that have been diagnosed with cancer. Typically, these individuals are given a choice of choosing one or a combination of three options: surgery, radiation, and chemotherapy. The treatment goal is to kill the cancer and its cells before the cancer and or the treatment kills the patient. Many agree that this system of cancer therapy are inhumane, undignified, and barbaric. Yes, many have questioned the lack of personalized patient quality of medical care and its single-minded focus on killing the cancer with toxic medications that can weaken the immune system, destroy the body, mind, and spirit. But what about the whole person in the treatment? The body, mind, and spirit? Can nutrition or natural supplements be of benefit in strengthening the immune system and aid the body's attempt at beating the cancer? Can natural medicines be used to alleviate the side effects of radiation and chemotherapy? Is there a way to blend all of these therapies together for the best results and comfort in the treatment of cancer? In essence, creating a patient-centered medical care. Today's program will look at a cancer hospital that is creating a new trend in treating the whole person using a blend of conventional and naturopathic medicine. The theme of Island Wellness is usually the patient's recovery from his or her disease is the story. However, due to the urgency of healthcare for those with cancer and its presumed choices of that one may have for its treatment, today the story is the new choices or options that are available to you if you have been diagnosed with cancer. And if you have HMSA, HMSA will cover its medical costs. Stay with us to learn more about how you can get this done. Today's story is about a man who has blazed the way for individuals with HMSA who have been diagnosed with cancer to seek medical care from one of the most cutting-edge cancer treatment centers in the United States of America. The Cancer Treatment Centers of America, you may have seen its infomercials on television, blends the latest in scientific technology with the holistic approach of naturopathic medicine. They use the most up-to-date diagnostic equipment, offer you cutting-edge conventional medical cancer treatment, and emphasize the importance of strengthening the immune system to battle cancer with research-based nutrition and vitamin and herbal medicines. Thus, the future of medical treatment of cancer is here today, and you can have it if you want. Let's find out what the future of medicine may look like if you would like this type of medical care, how you can get it covered by HMSA. Before I introduce our special guests, I'll give you some background information about Cancer Treatment Centers of America and what cancer therapy will look like in the not-too-distant future. Cancer Treatment Centers of America's first principle, like naturopathic medicine, is to treat the whole person. It's a whole person cancer treatment. The treatment is not only focused on cancer or killing the cancer, but on patient care. You will receive a multidisciplinary care team that is patient-focused. In your care team, you will have an oncologist, a specialist for your cancer, for instance, a gastroenterologist if you have stomach cancer, a naturopathic physician, a nurse, acupuncturist, and a nutritionist. And guess what? They all work together. They discuss your case together and set up a personalized treatment plan that includes the most sophisticated conventional medical therapy, supported by complementary medicines like naturopathic medicine that focus on quality of life, treating the body, mind, and spirit. One of Cancer Treatment Centers of America's promise is to provide you with clear information, powerful and thorough treatment options, all based on your specific needs. You are provided with a multidisciplinary care team. They explain the role that their specialty area can play in your treatment rather than telling you what you need. Your care team listens to you and provides you clear and well-defined choices of treatment, then help you decide in a treatment plan that best suits your individual needs. The specialists that would be in your care team would be a combination of oncologists, hematologists, gynecology oncologists, gastroenterologists, orthopedic oncologists, to name a few, as well as radiation oncologists, pain management specialists, plastic or reconstructive surgeons, naturopathic physicians, acupuncturists, chiropractors, and nutritionists. Examples of conventional medical therapies that are offered at Cancer Treatment Centers of America are chemotherapy, including chemoembolization, fractionated dose chemotherapy, intra-arterial chemotherapy, intraperitoneal chemotherapy, for example. Examples of radiation therapy available are Calypso 4D localization system therapy, external beam radiation, high-dose rate brachytherapy, local hyperthermia therapy, 3D conformal radiation, tomotherapy, high integrative adaptive radiotherapy, Theraphere radiation therapy. Also available are surgical oncology, immunotherapy, stem cell transplant, photodynamic therapy, hormone therapy, naturopathic medicine, and acupuncture. Now let's bring on our special guest. Welcome to Island Wellness, Lincoln, and Lincoln's wife, Dora.
Hi.
You two have been very busy so far this past year. How did you hear about Cancer Treatment Centers of America?
We didn't really hear about them. I was on the computer, searching around for alternatives, and I think they basically found us. It came as a pop-up on my computer.
Oh, really?
And I really thought that I had my pop-up blockers on, but it just kept popping up. And I guess at one point I thought I shut it down, and I actually must have clicked on a chat.
Mm.
And then next thing I know, I had someone on there talking to me, a live person, and this is 1 o'clock in the morning Hawaii time. And so it must have been, somewhere around 3 a.m. on the mainland, because it was an Arizona-based chat. And I think within the first minute, just the questions that they asked me,
mm-hmm.
I became very interested, because Lincoln's cancer was the second time around, and
mm-hmm.
he already told me he didn't want to go through the chemo treatments that he went through the first time. And so I was desperately looking for something else for him.
So you mentioned that Lincoln had been diagnosed with cancer before.
Yes.
So the first time Lincoln was diagnosed with cancer was in 2006.
Correct, September.
And what type of cancer was that?
It was a colon cancer.
Colon cancer. Had it metastasized also?
No.
Not that one.
No. It happened like almost 2 years later.
The metastasis.
Yeah.
Mm-hmm.
Okay, so the first time you had therapy for the colon cancer back in 2006,
Mm-hmm.
what type of treatment did you receive?
I received chemotherapy.
Okay.
Yeah, before the chemotherapy, they cut out a part of his colon.
Okay.
It was in the sigmoid area of his
All
colon.
right. Dora, you had mentioned that Lincoln didn't want to get chemotherapy again the second time.
Correct.
How many rounds of chemotherapy did you go through the first time?
I went to 12 cycles.
12 cycles of 5-FU.
Yeah.
Yeah, okay. So that must have been hard on you, going through 12 cycles of chemotherapy.
Yeah, that was very hard.
Yeah.
I suffered a lot, but I made it through.
Yeah. And I guess at that time you thought you were done. You had treated cancer, you had beaten cancer, and that was it.
Yeah.
And then when were you diagnosed with colon cancer the second time?
I found out that my blood rate was kind of high, so they told me that I had to take a scan.
Mm-hmm.
Then they found metastasizing my liver.
Okay. All right. And then I guess at that time, you had mentioned to your wife that you didn't want to get more chemotherapy.
Yes.
And that's when you went and
Yes,
did your
and that was
search.
stressful because what else do you do, if you're not looking for treatment?
Right. What were you looking for, though? I mean, did you have an idea what you were looking
No,
for at
not
that
really.
time?
I think I was just desperate and trying to find anything because for me, having more knowledge, you can make better decisions.
Right.
And so that's why I went on the internet as my source of information.
Did you have any idea about what Cancer Treatment Centers of America did and what system of treatment they had for cancer?
No, I didn't. And it was during that chat that, they told us about the state-of-the-art center and the approach with integrative medicine. I had no idea what integrative medicine meant at the time.
Oh, really?
And so a lot of questions came forth like that. And because I had a lot of questions, we stopped the chat and we talked over the phone. And I immediately recognized that these cancer information specialists at CTCA were very qualified in what they talked about because just the expertise and understanding. I was reading off of medical reports and, they were able to explain to me what integrative medicine meant and how they were all about treating the whole person.
And how did that sound to you?
It sounded very good to me because it was something different. They weren't talking about, they were really giving us hope and saying, there's so much more than just doing chemotherapy. And that was the whole basis of my looking on the internet.
So I guess initially, because of your experience the first time around with your treatment for cancer, the treatment was chemotherapy. I guess you thought maybe that was it. And if you didn't want to get chemotherapy again, what was there for you the second time?
Mm-hmm.
When you were talking to the specialists at Cancer Treatment Centers of America, and they were telling you about this integrative system of medicine that they used at their hospitals, how did that sound to both of you?
Well, actually, Lincoln wasn't really, he was sleeping. And, excuse me, and the specialist, the cancer information specialist said, we don't want to stress him and make him make big decisions like this, so why don't you go ahead and take some time to talk to him? And I was ready to say, when can we come, Well, what do you need? So we gave her, at that time, I gave her all of the insurance information, and I just put her on hold for 5 minutes, talked to Lincoln, and Lincoln was like, yeah, he's willing to try something different.
Because of the experience the first time around.
Yes.
Yeah. That's a common theme with a lot of people who have gone through cancer one time already, is they're not looking forward to getting chemotherapy again. Yeah, if the cancer does recur. So you were the first cancer patient that HMSA allowed to receive cancer treatment at Cancer Treatment Centers of America.
That's what we understood, yes.
Yeah. Would you tell us how you were able to coax HMSA into covering your cancer treatment care using an integrative hospital that's on the mainland?
Okay, first of all, again, it's nothing that we did. I think it was CTCA really going out on the limb and doing the negotiating for us. The initial attempt just came back with a no, that they were not going to cover it. And when I got that news, I was pretty desperate at the time because what other alternative did we have being here?
Yeah.
And so the cancer specialist told me that she would try again. They would try one more time to see if they can get anything. And a couple of days went by, I didn't hear back from them, and I was getting pretty discouraged. And I kept calling them, being persistent about it. And I was told that it was a decline because HMSA was going to cover only 20 to 30 cents on the dollar and only on specific services, not on everything. So then I asked her, well, can I at least get what they are willing to cover so we can continue to advocate here in Hawaii for that 20 to 30 cents on the dollar, that it would help us.
Okay. So you were still willing to go?
I was still willing to go. It was a denial at that point, and she said we wouldn't be able to financially do it without insurance coverage. So our whole basis was, okay, if HMSA is willing to cover 20 to 30 cents on the dollar, then tell us what is that 20 to 30 cents, because I believe at that time we had scheduled an appointment with your office, Dr. Uchida.
At that time?
At the time, thinking that we weren't going to be able to go, but that you were part of the whole, naturopathic medicine and what we've learned from CTCA, and wanted to at least have the benefits of it here.
Along with your cancer treatment here.
Yes.
If HMSA had denied you pursuing treatment care at Cancer Treatment Centers of America.
Yes.
Okay. All right.
And eventually, I know you want to know how we got them to pay for us. And
right.
So,
that's the whole goal of this TV show.
Yeah.
Today.
And so again, I went back to them and said, can we at least know what that 20 to 30 cents on the dollar is? And CTCA said, we can't disclose that, it's confidential. And, and she said, I'm sure you understand. Well, I didn't understand, because what part of the confidentiality was that? We gave them our confidential information. They went out on our behalf. And so my question was, tell me at least from the legal aspect why you can't share it. I mean, CTCA has this vision and this method of helping cancer patients. And if they cared enough to at least give us that information, we could go further here in Hawaii.
Mm-hmm.
And I believe at that time the cancer information specialist just couldn't answer the question and went back. And I didn't know she went back to help us again. And we were ready to just do the treatments here and work with Dr. Uchida.
Mm-hmm.
And the day that we met Dr. Uchida, in that afternoon, we got a call back from CTCA saying, you're coming to CTCA. We've got HMSA to agree to cover these expenses, and like how they would normally cover you in Hawaii.
Okay. Do you know what happened that made HMSA change their mind about covering your cancer care?
I think there's a couple things that happened. One was that the facility we're trying to get to, which was Arizona, it's closest in location for us.
To Hawaii.
To Hawaii, correct. Okay. Because CTCA have about 3 different areas, hospitals that they work with. Well, the Arizona's facility was brand new. They had just come up a few months before, our calls to them.
Mm-hmm.
And they didn't have any subcontracts yet.
Okay.
Okay, so the negotiators at CTCA then just tried to work with HMSA to say, you're going to cover them if they stay in Hawaii. If they come out to, let's say, our Illinois facility, that's a Blue Shield, Blue Cross facility.
Mm-hmm.
We're not asking you to cover any of their naturopathic expenses or anything like that. We're not asking you to cover their travel. We're just wanting you to cover their what they would normally get.
Medical care that you would get just
in
like
Hawaii.
in Hawaii. Okay.
And I guess at that point it really was, to me anyway, a no-brainer, I would think. And that's where the decision came forth. But it was a lot of CTCAs pursuing on our behalf that got this all settled for us, and we were able to go.
But also an important aspect of the decision was that you would have to travel to the Illinois or Chicago CTCA.
Yes.
Right. Okay.
Mm-hmm.
So, all right. So, how long did this process take?
You're going to be very surprised, because it took it didn't even take us a couple of weeks. And the only reason why it took a couple of weeks is because Lincoln had to have surgery on his liver. Okay. And could not fly, did not have a release from his surgeon for 6 weeks. And we were already 4 weeks, post-surgery. And we waited the extra 2 weeks just so he could fly. Okay.
So, Lincoln, you were diagnosed with stomach cancer with metastasis to the liver. In Hawaii, what did the oncologist recommend for you what kind of therapy did he recommend besides the surgery of removing the cancer in the liver?
Well, the whole thing that I got from him was after my chemotherapy, he said just to eat very good food, and that was it.
So he was recommending chemotherapy also?
Yeah.
How many rounds of chemotherapy did he recommend?
12 rounds.
12 rounds again?
Yeah.
Okay. Was it the same treatment as the treatment you had gotten before, the first time? The recommendations for
No.
the second treatment, was it the same as the first? No,
No.
was different. Okay. All right. So HMSA not only covered your cancer medical therapy in Illinois or Chicago, the CTCA hospital there, but they covered many other things too. Would you tell us what they also covered?
Well, I believe they covered what they would have normally covered us here.
Okay.
CTCA covers the travel.
Oh,
I
they
think
covered the
that's-
travel.
Yes, and
Okay.
that's where I believe the compromise and the negotiations happened. I get to see a listing of all the charges that have come through. HMSA has covered all of the services that for the traditional, conventional treatment of cancer, and CTCA covers the rest of it. And I believe that's where the negotiation, helped us financially to get there.
CTCA, I guess, negotiated with HMSA. They said they would cover your airfare
Mm-hmm.
and your, I guess, your accommodations
Yes.
if they covered your medical care.
Yes.
Okay. All right. So would you give us an idea what happened during your initial intake, your first visit at CTCA?
Well, for one, most everyone that knows us know I'm an optimist.
Okay.
But I'm not a traveler, and when it comes to folks outside of Hawaii, I'm not very trusting. So I'm sort of a pessimist, I guess, at that. And so, traveling out that way was more for, I didn't really think that we're going to do much with it except get an experience and get more knowledge about it.
You mean the first visit that
The first
you flew
visit,
out to?
yes.
Okay, so the first visit you went out there was mainly like a fact-finding mission?
Yes.
Oh, okay.
Yes. We have gotten so much from other people that said it's hard to travel,
When
get
you're getting-
chemotherapy,
Yeah.
and being so far away from home and the support. And it was pretty dismal. And just having a pessimistic start, I was carrying it with me there.
Okay.
But from the minute that we landed, I can't even, I get all choked up because they had a limo driver there for us.
So the limousine picked you up at the airport?
Yeah, limousine picked us up at the airport. From the minute we touched down to the time we got back to the airport, they took care of everything. There's such a working wheel that they truly take care of the patient.
Oh, yeah? So they
Yes.
took care of your accommodations,
Everything.
drove you to wherever you were staying,
Yes.
and then brought you to the hospital, I guess?
Yes.
Okay.
So we get a limo ride from the airport to the lodge. We check in the lodge. They provide us shuttle transfers for the intake to the hospital. They give us a badge that allows us to eat at their dining hall where they hire, world-class chefs. And they've got a spread of food that you can't even imagine. And, we feel guilty because we're there eating all that food and it's free.
Yeah.
We just show them our badges.
And it's healthy, too.
And it's healthy food. Exactly.
And it tastes pretty good?
Yeah, it tastes really good.
All right. So tell us your impression of the facilities at CTCA and, after your first visit.
Well, it was a whirlwind visit. It was 1 week, and they redid almost every test because they want to make sure that the results are their results. They're very meticulous in their ways. Lincoln went off to do a lot of tests, and right at the beginning, the thing that struck me was the interview. They gave us a nurse navigator to show us around. We were never lost. They sat us down and from the very first question asked us, how do you learn best? And I thought, because I do a lot of training myself, and I thought that was very intuitive of them, that they didn't assume we all learned the same way. Like Lincoln likes to read and look at pictures. Well, I like to just look at cartoons really, but pictures fine. I learned by pictures.
Okay.
And so he went off to do his thing, and I got to sign up for all these other training sessions.
So the
that they
spouse
offer.
also gets to, learn about the treatments as well as how to care for somebody
Yes.
with cancer and getting
Mhm.
therapy.
Yes.
Okay. Lincoln, what were you doing during that time? You went off and did your own thing, Dora was saying, but I guess you were getting more laboratory tests done?
Yeah, I did a lot of blood work, scannings, and then doctor visits, and all of those we have to wait for final results after that.
Okay, okay.
And I know Lincoln even mentioned that the equipment there was nothing like what he's gone through here.
What do you mean? It was old and
No.
breaking down? Or
The equipment is state of the art.
state of the art?
Yeah.
All right.
It's a lot different from Hawaii. So.
It looked a lot newer
Yeah.
and more sophisticated, I guess.
That's correct.
So where did you get when you were diagnosed with cancer in 2006, where did you get the bulk of your treatment there? Or here, I should say.
I had it here at Queen's Hospital.
Queen's Hospital. Okay, so I guess the facilities at CTCA in Chicago, outside of Chicago, were a lot newer.
Yeah.
More technically advanced, I guess.
Really advanced.
Okay. Dora, explain a little bit about the care team, because they talk about you're going to have a care team and they're going to take care of you and guide you. How did the care team help you in Lincoln's treatment for cancer?
The first thing is we didn't have to go and walk all over the place like we usually do here. You know, they give you a piece of paper, they tell you maybe we can fit you in a couple weeks or what have you. At CTCA, all of their doctors are all under one roof. Okay, so it was convenience and it was very efficient in the way that they moved us around. There were various doctors, and they all, came to work with us specifically. It wasn't through, and they asked us questions, taught us along the way, every step. And we had all those doctors that you mentioned. Till today, because we met them maybe once just on the intake, I don't even remember their name, but it made an impact on our learning. And in the end, they all came together on the last day to discuss the plan.
The treatment plan that Lincoln was going to get.
Yeah.
Okay. How did that affect you, Lincoln, or how did that help you, having all your care providers? The oncologists, the gastroenterologists, the nurses, the naturopathic physician. How did you feel about that visit?
I felt a lot safer and real. I can't really explain it, but you need to go to a facility like that to find out what's going on up there.
How different it is, the care there than compared to what you had in Hawaii.
They take care of you 100%. I mean, all they want you to do is be there, and they'll take care of the rest.
Oh, really? So I don't know if you can explain the difference between the therapy and treatment you received the first time you were diagnosed with cancer, and the difference between the second time you got your treatment for cancer.
Okay, the first treatment that I had, compared to the second one, the second treatment the dosage is made to your body, which your body can withstand.
Tolerate. Yeah.
The first one that I went to, it was very, very hard.
High dose.
You couldn't do nothing.
You just didn't feel well at all?
Not at all.
Okay. Dora, can you kind of share your feelings about the difference between the care that you felt Lincoln had in Hawaii the first time you were diagnosed with cancer, and then the second time? Because I guess you have the care team in Illinois.
Yes.
With you. And what was the difference between the first time around?
Well, like Lincoln was saying, a lot of their allopathic area would mix the chemo just to whatever his weight was at the time. Every time we went, they'd mix that special for him. And it was mixed only minutes before they administered it.
Okay.
The other thing, too, is the prep. maybe I just didn't understand the first time he went through chemo. Lots of times, if you're cognizant of what they're doing, then your body accepts it better. And maybe it was just that the first time around we didn't know what they were giving him. We just trusted the doctors, and we love his doctors and the medical team that's here. They do really care about us. It's just a different technology that's available up at CTCA, and that team there, they make you make decisions. And so as they were prepping his body, they told him, we learned a lot. There's so much information that goes into preparing a body for chemotherapy, because they're giving you poisons.
Yeah.
And so they understand that the most quickest growing cells are the ones that are going to be impacted by the chemo. So they know that. They take care of that up front best as they can. Like, they gave him pre-meds for his digestive tract, because that's an area that has, a lot of cells growing. They gave him Benadryl for the joints, because that's another area that they know will be impacted by the chemo. They gave him charcoal supplements to help with the nausea, all before giving him chemo. And he gets to sit in a chair where a nice man comes around with magazines, books. He'll offer you the world that's on his cart. And Lincoln's got a telephone and a TV there so that he can watch and get his mind off of the treatment. So
While you're getting treatment.
Doesn't feel like he's watching the dripping of the chemo.
So that's different than what you receive in Hawaii?
Yes.
Totally different.
And he has a live line to the cafeteria, and he can call for food.
Whatever you want.
Whatever I want.
Yeah.
Okay. All right. Can you share your impression about the staff and the doctors that you encountered at CTCA?
Well, the doctors and the staff, they work really close with me, from minute to minute. My doctor's always passing by, how you doing, which makes me feel good, because at least I know that I'm taken care of. So that's one of the positive things that makes me.
That you remember?
Yeah.
Yeah, they cared about you.
Yeah.
Yeah. All right. Dora, do you have more you want to add?
Yeah, and when he's going through chemotherapy, just so he's not having to go to many appointments, those doctors will come and visit him as he's doing his infusion to maximize on the amount of time that he needs to be there. I'm just impressed that all the patient care and consideration that goes into the process. And meeting the naturopathic doctor too, she comes to the infusion center and works with us, and she's right there comforting Lincoln, because I know one of Lincoln's biggest fear was the nausea of feeling sick. And so she worked with you, Dr. Uchida, also.
Yeah.
Whenever we'd go up there, they'd work together, and there's a nice story behind there too, that you both went to the same school. Right?
I don't know who she is, though, personally, but we went to the same school, the National College of Naturopathic Medicine. Lincoln, so you were starting medical treatment in Hawaii when you first were diagnosed with the colon cancer the second time. And what were the differences in the recommendations between the doctors in Hawaii and the doctors at CTCA? Was there any difference, or what was it?
There were a lot of differences, and the reason why I do a lot of the speaking is Lincoln and I we came up with roles. His role was going to be to just show up at the appointments, not worry too much about the other stuff.
Yeah. Okay.
And as his partner and his caregiver, I told him that I try to ingest as much as I could of the information, and then we talk about it together. And so I just wanted his full attention to just doing whatever it took to get to the appointments.
Okay. So you started treatment at CTCA, in July of 2009.
Little earlier than that.
Little before then, June 2009?
I think the first one, when we went there on the first week of assessment, at the end of that week, we were given a choice to start our first treatment.
Okay.
And, it didn't take us a huddle. We knew that's where we wanted to be, and we did take the first infusion that week we were up there.
Okay. Tell us what your treatment routine was at CTCA. When the intervals of treatment you would have to fly up for, and what happened when you were there.
Okay, when we get the infusion, first we have to meet with the oncologist, and we go through a nurse assessment where they take the weight, the blood pressure, all the vitals, and the doctor sits with us and talks to us and lets us know, that he's ordering up the chemo, when's the next appointment, what to expect, who'd be contacting us, and then we go to the infusion center, and of course they do the prep work and the infusion. And all through that process, other doctors are stopping by. It's wonderful because we're Christians, and we have pastoral care stop by also whenever we're in infusion, just to receive prayer. That always helps, because we're here because the glory is to God, of course, first and foremost. And upon releasing us, we already have our next travel arrangements all done. They do
really?
it. Yes, they have their travel department on the floor, on the infusion floor. And the doctor's orders are in. We get a call to confirm our next flight out, and really, it's all taken care.
So you already know what's going to happen the next time and when
Right.
that's going to happen.
And then when we get back to Hawaii, they call us. We have a case manager, and she follows up after every infusion. We make sure we come home with information in case something happens here, that the doctors are aware of the transition.
And you had mentioned that was an important aspect for you because you could call them 24 hours a day
Yes.
if you had any kind of question or if anything came up.
Yes.
Explain a little bit about that.
It's comforting to know as a caregiver and even as a patient that you're always going to get a live body when you call. I haven't had to call a lot only because they've prepared us so well before we left. When you go there, they give you a briefcase of information and all the contact people that you're going to need to know on your team, phone numbers. I came back and I didn't have a question, but they kept calling us. On a few occasions when I missed their calls, I called them back, and they call you back immediately. They want to make sure that you don't have any questions, or you're not going through some serious, medical situations that they need to be on top of.
How many times did you have to fly back to CTCA?
So far to date, we've been there 10 times.
10 times, okay. So in about 8 months. So would you tell us how frequent those visits were and how many days you would spend up there?
Okay, in the beginning, let's see. His infusions cycles were every third week.
Okay.
So we'd be home for 2 weeks and back.
You were concerned about the chemotherapy really affecting you really badly.
Yeah.
How did this style of chemotherapy affect you?
Well, my first chemo that I took was very different, where after I got done with my chemo, I went sightseeing after that.
So you felt okay?
Yeah.
Yeah.
It was just like I had a field trip.
Yeah.
And then it didn't even affect me.
Okay.
Yeah, so that was a plus for me.
I'm sure, yeah.
So I said, well, probably this is the first one, so what about the next one?
Right.
So when the next one came up in 3 weeks, I said, okay, let's see. We'll find out now. And then it was no different than the first one.
So you didn't feel really any real bad negative effects from the chemo?
No.
And that was the same for all 6?
Well, towards the middle, then I started getting a little nauseated, but wasn't where, I was down,
Right.
I couldn't do anything.
Oh, yeah. Or like you were sick for like a week or so.
I would be nauseated for a couple hours, and that was it.
That was it? Okay. So, obviously, some people might be thinking, okay, so the chemotherapy didn't affect you negatively, but maybe it didn't work for you either.
Oh, it really did work, because I lost my hair.
Okay. But also, we're gonna talk about this later too, though. But obviously, you don't have cancer now, and we'll talk about that in a few minutes. But before we talk about that, how did your naturopathic treatment here stack up with what was offered to you at CTCA?
He's looking at me. Well, we had already started on a supplement program that you put together for us, Dr. Uchida. And when we went to CTCA, we had to put that all up on the table and have their naturopathic doctor look at it and make recommendations. There was one item she took off only because they're highly conservative, and Lincoln had liver surgery, so she said it probably wouldn't have mattered, but she took that one off.
Okay.
But she agreed totally with the plan that you gave us, and it just worked so well for us. And I told Lincoln that I know that it's the supplements that helped him get through all those trials with the chemo, and why he wasn't as sick, because as you explained, they put the poisons in you, and it's your job to help us flush that and get the body's immunity system back up. And mind you, we were traveling during a period when the H1N1 was rampant in that area, Wisconsin, Chicago, and we were on the plane without face masks or anything like that, and
never got sick. Right. And that's, I guess, part of the care is we need to try to minimize any kind of side effects that chemotherapy might cause on not only the person's digestive tract but also the immune system, to help the chemotherapy out by strengthening the immune system. You had a choice of receiving your naturopathic medical treatment at CTCA, but yet you chose to continue with me with the naturopathic treatment in Hawaii. Why did you choose to do that?
Because we believed that it was the integrative medicine that was making the difference in his results, and we were getting it up there at no cost to us.
Yeah, you would have gotten naturopathic medicine.
Correct.
At no cost.
Right.
But yet you chose to pay me.
Well, we wanted to make sure, because I'm kind of ashamed to say this, but I used to think that holistic naturopathic medicines were make-believe, really. And I was struggling with that in the beginning, and I just wanted to see if what they offered us up there, it was going to be the same as here. And having found a trust in Dr. Uchida, in you, we didn't want to let go of that.
Okay. So I guess that helped, that their recommendations were very similar to my recommendations.
Yes.
Okay. Many of my cancer patients don't want to tell their oncologist here in Hawaii that they're also using naturopathic medicine in the treatment of their cancer because they're afraid that they're going to be scolded or laughed at. How did your oncologist and other physicians there at CTCA feel about naturopathic medicine?
Oh, that's what their whole program is about. It's based on healing the whole person, conventional and integrative medicine together. And that's why they're part of your medical team. They all work together.
All right. So well accepted and an integrative part of the treatment.
Yes.
Okay. So you've gone to Chicago now 7 times for treatment and follow-up. When was your last visit, and what were the findings of your last visits, and what's the recommendation for treatment now?
My last visit was February 10th. Oh, I'm sorry, February 3rd.
Okay.
Just recently. It was our 3-month follow-up, and we did a CT scan, and it was, again, showed no signs of cancer. And we're going to go for a follow-up again in 3 months, and if that is clear, then they stretch it out to 6 months.
All right. Well done. Well done. You must have ran into a few people up there, because you were there 10 times. You're probably milling around the hospital as well as other patients milling around. You must have heard some amazing success stories. Would you like to share a couple of your favorite ones?
You know, actually, Link and I were talking about this the other day and trying to come up with our favorite ones. But really, they're just all amazing stories. We figured that in the beginning when we went there, it was like miracle stories.
Mm-hmm.
But as we started going there more and more, that seemed to have been more like the baseline story of being misdiagnosed, coming there for treatment, finding out that there's more hope
Mm-hmm.
than what they had initially thought. And so I don't know that we have favorite stories now. It's more like that's the normal story when we
Mhm.
go there.
Okay.
You know, and it's just we find that there's so much people out there that's inflicted by cancer.
Mm-hmm.
And of course, Lincoln's is not a story of beating the odds or of a rare kind of disease.
Right.
It's really one that impacts a lot of people, and a lot of people in Hawaii and friends and families that have it. It's more unfortunate that we have it,
Mm-hmm.
but yet the treatment of it, there's just more options out there that we really want folks to know about, and that's the whole reason why, you know, we're not public speakers by any means, but we want to let Hawaii know that CTCA is out there. Integrative medicine is just a decision that they need to have as part of their plan,
Mm-hmm.
you know.
I guess it helps though too because HMSA will cover the treatment
Yes.
that you receive there. You
Mhm.
just have to go out and ask them to.
Yes.
Yeah.
And
So we'll talk more about that in a bit though.
mhm.
Can you put into words how you feel about your experience at CTCA?
I don't know if I can say it in words, but when it comes out on TV, it's going to look something like this. We're in awe, Dr. Uchida. It's something that it's hard to put in just a few words or a few sentences. We look at CTCA as giving us a gift that just you can't put a price on or words to.
I mean, and you're not rookies either, right? Because you went through cancer treatment 2 years earlier with conventional care here. And then you got to go to another facility using a different approach to medicine and treating cancer. And yet you were still blown away by your experience and the type of
Yes.
care you got. So,
Mhm.
yeah, you do have experience with what you're saying. Did you feel, or do you feel that you received the best care, medical care for cancer?
Yes, I think I got the ultimate care.
The ultimate care?
Yeah.
The Cadillac.
Right. Would you like to share with people who have just been diagnosed with cancer, but are not sure whether they should seek medical care at CTCA?
It doesn't hurt. I would say contact them. Get a second opinion. Just go. It's not going to cost you. They usually just bring you over. They'll pay for a caregiver also, and an assessment can be done in 1 week.
So the norm would be if you're seeking medical care at CTCA,
Mhm.
that they pay for your accommodations and your travel arrangements,
Yes.
and they pay for a caregiver to go with you too?
Yes, on the first
On the first
trip.
trip, okay.
Mhm.
But maybe not on the second.
Correct.
But you are special because you got your care. I mean, your
I
your
did have a
expenses were
few.
taken care
Mhm.
of. All right.
Not
so,
all of them, but some.
Oh, okay.
Mhm.
So, all right. Lincoln, you're the first person that HMSA sent to Chicago's CTCA hospital. You now set a precedent. So now it must. So it's so much easier for other people to seek care at CTCA from Hawaii anyway, and who have HMSA as their insurance provider. Tell us how you feel about that.
Well, I feel if we can help other people, not to worry about seeking help,
Mm.
the hardship or whatever. If this is one way of getting through, this is the road to go.
Okay. We have to explain that you're not the only person that HMSA has covered to their medical expenses to get treatment at CTCA in Illinois. Would you tell us the story about your aunt who was recently diagnosed with cancer?
My auntie was diagnosed with breast cancer, and then she had found out from her doctor that they was going to do some surgery, and then they asked us about the treatment they was going to in Chicago.
Mm-hmm.
So they took the second opinion and they went, and then I guess they went to the treatment.
So they're getting treatment in Chicago also.
She has HMSA.
Okay, and that's the key.
Her first phone call was, yes, you can come up. I mean, there was no, oh, let's go and negotiate this or anything like that.
You mean from CTCA?
Yes, when she called CTCA and she told them she had HMSA, the caller knew, and he said, oh, we have one other person coming here from Hawaii with HMSA, so you can come.
Okay, so there was no question now.
Yeah.
So all someone has to do if they have cancer and if they have HMSA insurance coverage, all they have to do is call CTCA in Chicago, and then they'll do all the work for them.
Yes, and I'm sure there's different types of coverages,
Mm-hmm.
And we happen to have a preferred plan, and I'm not sure what others have, and it may be a little bit different.
Okay.
But that should not stop them from having, to make a call.
Lincoln, how's your auntie doing now with her cancer care?
We just found out from her 2 days ago that she went for a follow-up. Her signs are really good.
Promising, very promising.
Yeah. They found out that the cancer decreased in 1 millimeter in size.
Okay. 1 centimeter all the way around.
Ah, okay.
And they weren't able to detect the cancer that they found earlier on her lung and under her arm.
Oh, really?
Mm-hmm.
Very good. So she was stage 4 also.
Yeah.
Yes.
All right. So very, very nice success story again.
Mm-hmm.
I know she's not out of the woods yet, but it's looking really promising for her. So yeah.
Yes, and she's having naturopathic medicine too.
Up there?
Yes.
Okay. How does she like the naturopathic medicine treatment?
She said that's the way to go.
Really?
It works.
That's a good question for you two. What's your opinion now of naturopathic medicine?
I think that people just need to make a decision that it needs to be part of their plan, because it's part of the whole package. It's not just the chemotherapy. It's the naturopathic medicine that works together with it that creates the success.
Okay. Lincoln, you had talked about your hair. You had lost some hair when you got your chemotherapy treatment.
Yeah, I lost a lot.
Okay. But
All.
what happened after chemotherapy stopped?
After my chemotherapy, I say about 2 weeks later, I had the signs of getting my hair back, and I said, hooray!
And you said it came back black now.
Yeah, it came out darker and double the size.
Double the size. So you have more hair now.
I have more hair.
Must be that naturopathic medicine.
Gotta
All right, I have one more question for you, and we're running out of time, but there are those who probably are concerned about the time, distance, and travel to Illinois to receive treatment from a facility so far away. How did the periodic flights to Chicago and receiving the chemotherapy affect you physically and mentally?
Well, like I said, it didn't really affect me a lot, which was good, because sooner or later I might have to travel by myself. So now I know that the treatment is very good, that I'm not afraid.
Your body tolerated it well.
Yeah.
Okay. For those of you who are interested in the details of Lincoln's medical treatment, Lincoln and Dora will be back with us to share how he is beating metastatic colon cancer with conventional and naturopathic medicine on another program. Lincoln, continued success in you beating cancer. Lincoln and Dara, thank you so much for sharing your incredible story on Island Wellness.
Thank you.
Thank you for having us.
I'd like to thank all of you for tuning in and joining us today. I hope you enjoyed the program and learned something of value. Hope that you continue to look for and tune in to Island Wellness on Olelo Television. My name is Dr. Jason Uchida. Thank you.